Thank you. Welcome everybody. Can you hear me? Great. I am going to share screen so I can share a little bit about what I have been doing. This is a huge shift in gears from that wonderful last talk. My focus is really on healthcare transition. So a huge part of care for all of our, oh, it's sharing with subtitles. That's okay. My huge focus in practice has really been how to care for patients and their families across the lifespan. And that's really why I did my training in pediatrics and internal medicine. I truly wanted to understand the, oh, it says I'm paused. You can't see my slides, can you? You can see them.
We could see the,
all of them.
yeah, we can just see the, like the outline piece of it. There you go.
This,
Well,
is it moving forward?
it's moving now. Yeah, it's
Okay.
moving.
Sorry. So my passion has really been caring for patients across the lifespan, and more specifically, really looking at transition. So, particularly for patients who have diseases of childhood and complex diseases, how do we help them move into the adult world as they grow? And as we see, so many incredible parents like our last speaker and like Sarita Edwards, who have learned to be such incredible advocates for their families, that period of time where they are getting older and having to make big changes in their medical care and related to insurance and social work support, how can we really support families during that difficult transition? So that has been really my focus at UAB and Children's in Birmingham, is that I really in my personal practice noticed that this was a huge gap for all of our patients at Children's and really throughout the state of Alabama, that this was not being done in any sort of formal way. So I paired up with Betsy Hobson, who has really been an expert in transition work for patients living with spina bifida, and we look to really use her work to apply to all of our patients living with any complex disease. So the background, I don't need to spend much time on. Everybody here is well aware that there are a lot of adolescents and young adults who have chronic diseases that are living into adulthood, and that really a lot of national organizations have called to put more attention and resources into transition. So my work started specifically looking at Children's of Alabama in Birmingham, and really doing a deep dive to ask all of the specialists at Children's, how do you feel like you're doing with transitioning your patients to adult medicine? And to be honest, I don't think anyone would be surprised that most of them felt like they were doing a really bad job. Children's does such a great job of providing that multidisciplinary care. They're incredible doctors. They hold your hand through some of the most difficult decision-making and medical things that you'll have to think through as a child. But then they're not really equipped to prepare you of what is that next step as you get older. And so you can see here, these were some of the common themes and quotes that came out of our deep dive. And this was from leadership at Children's, saying that they felt like their patients had no formal transition plan. Really, if you look to the bottom, some people said that they felt like their patients regressed or did worse after leaving Children's. And some even said that they thought that we coddle patients and their families too much when they're children, and that makes the transition more rough. And so this really triggered a bigger high-level discussion of how can we make sure that our families are making this transition successfully, and how can we prepare them so that they don't feel like they're just being cast out into a dark hole or falling off a ledge, is how some parents have described it to me when they're leaving Children's. So this just looks more at specific diagnoses and specific diseases where the children's specialists kind of rated who they felt like they were doing a good job transitioning. You can see on the left some of the diseases that they felt like they were doing a better job with. These programs had already set up transition programs. So for patients with cystic fibrosis, spina bifida, sickle cell disease, they really already had transition programs up and going. And then if you look on the right, groups that scored less than 2, which is really not acceptable, included a lot of rare diseases, rare genetic syndromes, underlying, GI issues, cerebral palsy, patients with neuromuscular disease, patients with sleep disorders, patients with lupus. So again, common diagnoses and things that we are used to caring for at Children's, but there was truly no plan for what would happen to these patients when they turned 18 to 21. And this again just highlights a lot of different rare diseases where patients really had no transition plan. So all of that, we knew there was a need. We put it on paper, and we applied for a large grant to actually build a transition clinic that would help create this transition program and planning and policy for all patients at Children's, not those with just specific diagnoses. And we were awarded that grant funding in addition to health system support, and we're able to start what's now called the STEP program. So this stands for Staging Transition for Every Patient. And it was a huge collaboration of lots of people at UAB, other national institutions, and lots of departments throughout the pediatric and the adult world to make this successful. So what do we actually do in the STEP program, and what have our goals been? So those of you who are familiar with policy and transition work and advocacy, the first step is really having a policy, right? Like, when do you transition? Who transitions? Who stays at Children's forever? Because at the basis of all of this, the goal is to truly provide the best care to every patient. For some patients, that may be staying at Children's until they're at an older age. You really can't apply the same rules to every single patient. Every patient comes with an individual story. And so how can we make a policy where we keep that in mind? The second part was really building that bridge from Children's to UAB. If any of you have been there, there's a beautiful bridge that attaches those buildings, but there's not necessarily great communication as people move across that bridge. And so how can we create really a landing pad for patients to enter into smoothly with coordinated care and make sure that you're making that transition when it's best for your family? And so that is what we've done with the STEP clinic, which I will tell you guys more about in a minute. The third piece has been developing relationships with the specialists on both sides and really understanding who are the physicians in all of these specialties who are the right fit for our patients with rare disease and complex disease. You can all agree, after probably having met a lot of doctors and a lot of different places, that there are truly angels and star healthcare workers who have a passion for patients with rare disease and who are committed to researching and reading about the newest outcoming data and studies. And those are the people we want to work with and make sure that we're connecting our patients to. So we make that a huge point to have meetings with physicians all over the health system to identify who are the right specialists for our patients. The fourth was partnering with existing transition programs. I mentioned there's several around the country at Rochester, Baylor, Cincinnati, who we've really learned from and who've been great partners in this work. The next piece is really looking more into the community. So how can we partner with adult providers, urgent care doctors, hospitalists, because we know even in one specialty clinic at UAB, we're not going to be able to care for every patient, and that we're going to have to do a better job of training all of our residents and medical students and community doctors to be able to care for patients with any underlying complex disease. And then we've looked at IT development of transition tools and how we can really better prepare our teens and young adults or their families for the transition. So with STEP program, there's really been two components of this. It's across Children's and UAB, as I've mentioned. The first is at Children's. So at Children's, we've been working to create a framework within all the specialties to really start having the discussions at age 14 for most of our patients and their families of, starting to think about that. What is that going to look like for your child when they turn 14, 15, 16? Is the goal for your child to be independent and living on their own and having a job? We need to start thinking about those things now and how to make sure that we're utilizing resources and giving our children the skills. For others, the goal may be care planning or, extra resources in the home to provide more care. A lot of shifts occur with insurance and all kinds of resources when patients turn 18. So how can we start to think about what shifts may happen at 18 and make sure that we're thinking about disability and insurance and waivers and all the supports we can put in place to make a family successful. And then I mentioned at UAB, we created really this landing pad called Step Clinic. And so this is our clinical component of the program that sits within primary care at UAB. We felt like it was really important for our patients as they enter the adult world to be seen in an adult medical care setting with other young adults and older adults and really know what it feels like to be in an adult medical practice. Our criteria for patients, as you can see, are really loose. We really want to be able to provide resources to any family in need without restriction. So really, as long as the patient is over 18, we're seeing people from all over the state in any chronic disease of childhood, regardless of insurance. So really trying to remove barriers and making sure that no matter where your family is at in this journey, that we're there to help kind of guide through. Chronic disease of childhood. These are examples of a lot of what we're seeing in our patients, but truly it can be anything, such a wide range of conditions. Like I said, the focus for us is if you are a family in need of resources related to transition, no matter what that disease process is, we're going to be there to help guide you through that. So what do we actually do when you come to clinic? This is what families and patients want to know, is what's going to happen when we come over there. And it can be really scary meeting a new doctor, especially when you've had a lot of doctors and healthcare experiences in your life, some that have been amazing and some that may not have been so amazing. And so really we have a dedicated team. We get all of the records from children so we can know exactly what happened when you were a child and what your medical struggles were. We do a series of screening just around mental health for our patients, around caregiver burden for our parents, so that we can make sure that we're also helping our parents plug into resources. And then we create an ITP, or what's called an individualized transition plan, for every single patient. And what this looks like is really a focus on goal setting for the patient and family. So we typically will make a goal around medical care. So what are the referrals you're going to need? Let's sort out, which of your doctors may still be at children's, which may be in the adult health system, which may be in the community. Really making it clear where all of your medical care is and organizing that for a family, because transitions of different doctors can happen at different times. The second piece is we really just want to get to know our patients and families and understand what is the key to their success or making them happy. So we let the patient and parent each make a goal that we help hold them accountable to. And then we pick a goal that's really specific to what their transition planning is. So for a patient, for example, who really has relied on mom, let's say, to make all their medical appointments and to make them take their medicines every day, how can we work with that patient to get them starting to take the steps to really own their own health care? And so we set a goal around that. And then for some of our parents, if they're struggling with finding resources, the goal could be around helping the family plug into community resources. So again, it's really individualized to the patient. We take care of any referrals to adult specialists based on who we think would be the best fit for you and your family. We communicate with those specialists and make sure that they know that you're coming and that they know your story, and so that we can make that as really seamless as possible. We handle all primary care needs. So if you're needing basic labs and shots and just management of basic medical issues, we can do that. But some of our patients have primary care doctors closer to home, and that's okay too. We spend a lot of time making sure our patients know where to go if they get sick, right? If you're in the middle of a transition, it can be really complex. Like, well, wait, my pulmonologist is at Children's, but my stomach doctor's at UAB. So how do I know where to go now? If I get really sick, which ER do I show up to? And so we spend a lot of time thoughtfully thinking about that as well, so that our patients aren't lost in the process. And then we have an amazing social work team who spend probably an hour with every patient at their first visit, talking about a lot of the things I mentioned. So, resources for vocational rehab, or for, things that you may need related to school to be successful. We spend time talking about guardianship and helping families kind of figure out how to put that onto paper. And then for some of our families, we just talk about goals of care and what the rest of life is going to look like. And so really, again, just a very holistic approach, head to toe, thinking about all the medical, but also, again, how can we help you succeed in your personal and professional life as you get older? The other thing to just add about this is that for specific disease processes, we do have specialists come to clinic with us, which has been really incredible in reducing barriers to patients getting to see their specialists, because you guys would all agree for any adult, it's really difficult to get to multiple different doctor's appointments on different days with different people, and you add more complexity or barriers into that, and it's nearly impossible. And so we quarterly have epilepsy doctors and neurologists come with us. We have rehab doctors come to clinic with us. We have a neuromuscular specialist. We have a pulmonary doctor and a renal transplant doctor. And so these doctors come into our clinic, and we coordinate that we see the patient with those specialists, so that we can make sure that we're all on the same page about care. I mentioned our social work and care coordinator team. We also have a physical therapist in clinic with us who can do physical therapy in clinic, or who can help us just with equipment needs and making sure that power chairs and other equipment are all functional and up to date. And then we have lots of community partners and are really working strongly right now on having a counselor in clinic with us. So the clinic is located at UAB in the John Whitaker building. I mentioned this already, really right in the center of where the adult primary care clinics are. And this is how you set up an appointment. So basically anybody, a family member, a provider at Children's or UAB could initiate this process, and really all you have to do is call the UAB Access Center at the number I have on the screen, and you can schedule a new patient appointment. And if you have questions or want to talk about more what we offer and if it's the right fit, my email is also at the end of this talk, and I'm glad to share. You can certainly email, and we can have somebody call to talk more about the clinic with you. So as of today, we opened this clinic about 10 months ago. We have now established over 150 new patients as of this week over the last 10 months. And I already mentioned some of the specific clinics we've had with all the specialists joining in. And it's truly been an incredible adventure for me. I always knew this was something I was passionate about, but to see other healthcare providers all over the health system be so passionate about this topic and wanting to come to clinic with us, and even hearing from specialists this week asking to come to clinic more with us because they love getting to see patients all together and have so many different brains in the conversation. It's just truly been meaningful. And I think for the families, it's given them such a sigh of relief that they know that they have a team that is going to be committed to them, who's going to help them through this, and not let them certainly fall off any cliffs or ledges while they're making this transition. And then these are things that we hope to achieve by giving this level of care to these patients. So improving access, making sure our patients can get to all of these doctors, decreasing ER visits and hospital stays, and then really helping our patients improve their readiness for transition, improving our patients and families' quality of life, and improving our patients' ability to care for themselves and take ownership of their health care. And then the last piece I think might be the most important, which is just increasing education locally and nationally about the work we're doing so that more physicians are comfortable caring for all of our family members and patients as they age. And lots of future growth. Children's is looking to build a complex care program, and we're hoping to help be a part of that and have it really flow naturally into the adult world, and looking at lots of educational opportunities and creating a patient advisory board so that we can make sure as we grow that we're really meeting the needs of our patients and families. And so with that, I will end and take any questions. I have my email right here. Like I said, please feel free to reach out if you have questions or if I can give more information about the work that we're doing. And I will just end by saying thank you for having me and letting me share the work that we're doing. And thank you all for everything that you're doing to advocate on a higher level for these patients.